Boomer was like healthy, doing well, and then he had a really very scary episode and he threw up like huge amounts of blood.
He came in for some sort of non-specific signs. They were more related to like his GI tract. He ended up having an abdominal ultrasound performed, basically to look at his internal organs. And at that time, there was a tumor noted in his adrenal gland. Traditionally, removing an adrenal gland tumor involves a pretty large abdominal approach to get access. Because we had intervened or made this decision relatively early on and his tumor was still small, we had the opportunity to try to utilize a less invasive surgical option like laparoscopy. And we're using a camera like this is very small. It goes through a 5mm surgery site in the body wall, and then we can introduce other working instruments like this grasper to basically manipulate tissues and grab things that we need to, and we're able to get his tumor removed.
The staff were so welcoming and accommodating when we would call and check in on how he's doing. We also got some photos back of how he was doing, and that was the reason we were able to sleep that night. He was in his cone in one of the photos, and he was like very angry looking, and then the next photo he was on his walk outside in the snow and he was so happy.
Boomer's a very energetic and expressive patient, and he bounced back very quickly doing that type of behavior. He seemed to be acting like his normal self quite quickly. I think there's a very high likelihood that this will never come back in his case, and it was good that we addressed it before we got to a point where we wouldn't have necessarily had the same outcome.